Hi, it's the Nursing Professor. Welcome back to another episode of Fundamentals on Friday. Today we're going to talk about the blood transfusion. Blood transfusions are super duper important, and they require really detailed care. Do not delegate any of this to an unlicensed assisted personnel, all right? Because you need to be doing that frequent assessment to make sure that your patient is not having any adverse reaction. So first, why would we get a blood transfusion? Typically, it's for a person that either had surgery, had major blood loss, or they were in some sort of traumatic incident that resulted in blood loss. We also give it for those people who have severe anemia. They have a low H&H or hematocrit and hemoglobin. We have that lab value and we see that they are very low. People with blood disorders like sickle cell, leukemia, hemophilia, chronic diseases like kidney disease, people who are on dialysis frequently get blood transfusions, and those with low platelet counts that could result from a disease process or that they had chemotherapy. But any of our blood products, be it whole blood, red blood cells, platelets, plasma, any of those need to only be infused with normal saline, and we'll get back to that in a moment. So before we begin this blood transfusion, there are a few things we must do. We must make sure we have that right patient. So verify the patient, 2 RNs. You're going to look for their date of birth and that you have the correct person. So name and date of birth would be 2 identifiers, and you're going to check it against their ID band. All right. You're going to confirm their blood type and RH factor. Okay, so if it's A positive, should be A positive, those types of things. We're going to make sure that those match. We're going to check the expiration on the actual blood product to make sure that it is still good. Make sure we have a consent on file and explain the procedure to the patient. All right, so that's before we start any type of infusion. Then we get our first set of vital signs. That first set of vital signs say that, okay, we're good to begin. We're going to make sure that we have a patent IV line, and that IV line should be a 20 gauge needle or less, so it could be 18 gauge, 19 gauge, but you're going to check that before you actually even get the blood, so you're not wasting any time. So you can do a flush, you can actually hang the normal saline prior to getting the blood, so again, you're not wasting any time, because once you get that blood, it's only good for 4 hours after it leaves the blood bank. Okay, remember that. All right, you're also going to make sure you have the right IV tubing, because the correct IV tubing has a filter in it. So let me take a look at this. All right, so this is your